Hi, everybody. I'm Kristen DeStigter, the chair of the Department of Radiology, and I want to welcome you to the University of Vermont residency program. I'll start with a little information about me. I grew up in the Midwest and in previous work lives have been a high school French and English teacher in Los Angeles, a private practice radiologist in Michigan for 5 years, and a parasite researcher in East Africa. I was working with the team on schistosomiasis that did the phase 2 drug study for the treatment of choice. It was this experience where we used ultrasound to track the response to treatment that drove my interest in global health and in radiology and finding ways to pair the two for better health outcomes in low resource areas. I raised 4 kids in Vermont, and I love it here for so many reasons, including the natural beauty and tremendous activities, as well as general community commitment to the health of the planet. When I joined the University of Vermont in 2001, I was the medical student director and then soon became the radiology residency program director for 14 years. During that time, I participated nationally and internationally in resident education, serving on many national committees, including the ACGME Radiology Review Committee, and as chair of the Association of Program Directors of Radiology. With my commitment to academic radiology, I am now on the board of the Society of Chairs of Academic Radiology Departments. I'm an impact person. I encourage everyone to think beyond the reach of what they do every day to give back to the world using their skills, talents, and passions. As a leader, I have a commitment to impacting through continued excellence in education, extraordinary clinical service, research and innovation, mentorship, good stewardship of our resources, and using collaborative, collective expertise to improve healthcare worldwide. The perks of training here in Vermont are many. We have highly dedicated faculty with almost 100% retention. People come to Vermont and stay, and they commit their careers to teaching our residents. In this program, you will train on the most sophisticated equipment in the world. In addition, we have recently implemented a state-of-the-art IT platform with the most modern PACS, smart work list, built-in PowerScribe 1 dictation system, all sitting on top of Epic Radiant and our vendor-neutral archive. This allows us to have entirely seamless image sharing across our network. In the University of Vermont Health Network, we cover 6 hospitals, but all of your training is centered here at the Academic Medical Center at the University of Vermont in Burlington, with options to do community radiology electives in your 4th year. A few years ago, we implemented a health services research division within radiology with a goal to examine the future of radiology as we respond to all of the changes around us in digitalization, artificial intelligence, and democratization of health services closer to the patient. The question is, what does radiology look like as we move to population health? How do we optimize radiology service delivery to improve patient safety, better the patient and provider experience, and lower the overall cost of care? Those things aren't really often taught in radiology residency programs, but we all need to rethink how we use our modern tools and our expertise to reach the most vulnerable people. In 2008, I co-founded Imaging the World, a nonprofit organization that delivers ultrasound technology, training, and infrastructure to the most rural towns in Malawi, Uganda, and Kenya, and I still volunteer for that organization. Radiologists teach the frontline clinical workers how to do ultrasound. We compress the images and we send them with high fidelity using teleradiology for remote review so that we have a high quality, safe service for patients at the rural clinics. Residents and faculty in Vermont have an opportunity to participate in the program in education, research, and innovation, both here and overseas. Our health services research team and several of our faculty members are contributing to impacting global health in meaningful ways. I realize that not everybody has a goal to participate in global health or in population health, and that's why I look forward to working with you on your own personal strategic plans and goals and vision for your life so that you might use your talents and passions to have a meaningful impact. Thanks for visiting the University of Vermont today, and please feel free to email me if you have any questions.